I have sat across from many women who share the exact same heartbreaking story. They sit quietly, hesitant to speak, and describe the excruciating, debilitating pain they experience every single month during their period. They describe pain that keeps them in bed, makes them miss work, and completely strips away their quality of life. The most painful part of their story isn't just the physical sensation. It is the fact that for years they have been told by well-meaning people, and even their own doctors, that this is just part of being a woman. They are told that cramps are normal and that they simply need to push through it. I want to tell you clearly right now that severe, debilitating pain is not normal. It is a sign that something deeper is happening inside your body, an indicator that your system is crying out for help. The reality is that 1 in 10 women lives with a condition called endometriosis. That is a massive number of women navigating their lives while carrying an invisible burden. Yet, despite how common it is, the journey to finding an answer is incredibly long. On average, it takes between 7 to 10 years for a woman to receive a proper diagnosis. Think about that for a moment. 7 to 10 years of wondering why you feel so awful, going from one doctor to another, and feeling dismissed or misunderstood. During this long window of time, the standard approach is almost always the same. Women are prescribed birth control pills, given stronger pain medications, or told that surgery is their only real option. Sometimes surgery is necessary and can provide vital relief. But what breaks my heart is that during those years of symptom management, nobody really pauses to ask why this is happening in the first place. This is where a different way of thinking about medicine becomes so essential. We need to practice the medicine of why. It is not enough to hand someone a label, tell them the name of their disease, and give them a pill to cover up the symptoms. We have to look upstream to find the root cause. We have to understand exactly why your unique body developed it. Endometriosis is a much larger, more systemic issue than most people think. Traditional medicine treats it as a simple localized problem confined entirely to the uterus. But the human body does not work in isolated compartments. Endometriosis is actually an inflammatory condition, an immune condition, and a complex hormonal disorder. It is intimately connected to your gut health, to how you metabolize estrogen, to environmental toxins, to blood sugar, and to stress. Let us break down what is actually happening inside the body in a simple, clear way. Endometriosis occurs when cells from the inside of your uterus, the endometrium, leave the uterus and go into the pelvic cavity, which is the area outside of the uterus inside the abdominal area. Once there, these endometrial cells get stuck. They attach themselves to the outside of your organs, to the pelvic wall, or to the tissues supporting your uterus. These misplaced cells still respond to the natural hormonal signals of your monthly cycle. When your hormones tell the lining inside your uterus to swell and bleed, they send that exact same signal to the cells stuck outside your uterus. So, during your period, these displaced tissues also try to swell and bleed. But because they are trapped inside your pelvic cavity, there is no escape route for that fluid. The blood and tissue have nowhere to go. This creates deep, localized irritation. The surrounding tissues become red, swollen, and highly inflamed. Over time, this repetitive cycle of monthly inflammation can cause the tissues to become sticky, forming scar tissue and adhesions that can bind organs together. This is the biological reason behind that deep, agonizing pain that so many women experience. Because these endometrial cells can settle anywhere in the pelvic region, they often choose areas around the fallopian tubes and the ovaries, which frequently impacts fertility. But the reach of these displaced cells does not stop at the reproductive organs. They can also land on the bladder or directly on the bowel. This explains why the symptoms can be so incredibly confusing and varied. When the tissue affects the digestive tract, it triggers a cascade of gastrointestinal symptoms. Women regularly experience severe bloating, painful gas, chronic constipation, or sudden diarrhea. Because these symptoms mirror digestive issues so closely, it makes a proper diagnosis even more difficult to reach. A woman might spend years treating what she thinks is a stubborn stomach bug or a sensitive colon, when in reality the root issue is endometrial tissue irritating her digestive system from the outside. What we see here is a fascinating and highly unusual biological process. It is almost as if tissue from one organ, like your kidney, suddenly decided to transplant itself and grow in entirely different parts of your body. It is a strange phenomenon, and it creates an incredibly symptomatic, painful experience. Once these cells establish themselves outside the uterine lining, they do not sit there passively. They actively create a feed-forward, self-sustaining loop of inflammation. The irritation they cause triggers the immune system, which brings more inflammatory chemicals to the area. Even more remarkably, these misplaced endometrial cells can actually generate their own estrogen through a process involving an enzyme called aromatase. This means the tissue itself is manufacturing the very hormone it needs to grow, fueling its own expansion and creating a vicious cycle that is incredibly difficult to break if we only look at the surface. For a very long time, both the medical community and the public have thought of this condition purely as a gynecological issue. We looked at it through a very narrow lens, assuming it was simply a localized breakdown of the female reproductive system, a basic hormone imbalance that just needed to be manipulated with medication. But in my years of practicing medicine, I have come to realize that the human body never works in isolated compartments. Everything is deeply connected. When we examine the underlying science, we find clear evidence that this is not just a localized hormone problem. It is fundamentally an immune condition, showing many characteristics of an autoimmune disease. Your immune system is designed to act as a protective shield, constantly scanning your body to ensure that everything is in its proper place. In a perfectly balanced system, if uterine cells somehow escaped into the pelvic cavity, your immune system would recognize them as being out of place, clean them up, and dissolve them before they could ever cause trouble. But when endometriosis develops, there is a fundamental breakdown in this surveillance system. The immune cells become confused or overwhelmed, allowing these displaced cells to survive, attach, and thrive where they do not belong. This triggers a localized and systemic immune response, keeping the body in a constant state of defense and creating a landscape of chronic inflammation. To understand why the immune system loses its balance like this, we have to look at an area of the body that many people would never think to connect with pelvic pain. We have to look at your digestive system. In our medical practice, we have a foundational rule that we teach to every single patient, and that is to always start with the gut. This is the kind of deep, practical connection that most doctors simply do not have the time to explain to you during a standard, hurried 10-minute clinic appointment. But the truth is that a massive portion of your immune system is located directly inside your digestive tract. Because of this, any imbalance, irritation, or dysfunction in your gut will immediately send ripples through your entire immune system, causing widespread inflammation that can manifest anywhere in the body, including your pelvis. There are two primary ways that gut health directly influences the development and severity of endometriosis. The first is a concept we refer to as increased intestinal permeability, which many people know as a leaky gut. Your intestinal lining is supposed to act like a very fine, highly selective filter. It should only allow fully digested nutrients to pass through into your bloodstream while keeping waste, toxins, and undigested food particles trapped inside the digestive tube to be safely escorted out of the body. However, due to chronic stress, poor dietary choices, or medications, the delicate lining can become compromised. The tight junctions that hold the cells of your gut wall together begin to loosen, creating microscopic gaps. When this happens, uninvited guests like bad bacteria, bacterial fragments, and partially digested proteins leak directly through the wall and enter your systemic circulation. Your immune system, which sits right on the other side of that gut wall, sees these foreign invaders and immediately goes on high alert. It starts firing off inflammatory signals and releasing chemicals that travel through your bloodstream, escalating inflammation across your entire system and directly feeding the painful inflammatory lesions inside your pelvic cavity. The second major factor is something called dysbiosis, which is a medical term for a very simple concept. I like to tell my patients to think of their gut microbiome as a beautiful, thriving inner garden. In a healthy garden, you have a vast diversity of beautiful, beneficial flowers and plants that keep the ecosystem balanced and healthy. But if you stop tending to that garden, or if you feed it the wrong things, the weeds will start to take over. Dysbiosis simply means you have too many bad bugs, or weeds, growing in your digestive tract and not enough of the good protective bugs. These bad bugs do not just sit there quietly. They produce toxic byproducts that irritate the gut lining and trigger a continuous, localized immune reaction. This profound connection between gut health and pelvic inflammation is firmly backed by scientific research. Clinical studies show that women who suffer from endometriosis have a 2 to 3 times higher risk of being diagnosed with irritable bowel syndrome, or IBS, compared to the general population. There is a massive undeniable overlap between these two conditions. Furthermore, Women with endometriosis exhibit significantly higher rates of food allergies, complex food sensitivities, non-celiac gluten sensitivity, and even full-blown celiac disease. Their bodies are in a state of heightened reactivity, treating normal, everyday foods as dangerous threats because their digestive terrain is fundamentally out of balance. What is even more fascinating is that this microbial imbalance is not just limited to the digestive tract. Recent scientific discoveries are opening up a whole new paradigm by looking at the connection between the vaginal, cervical, and uterine microbiomes and the risk of developing endometriosis. Just like your gut, your reproductive tract relies on a very specific protective balance of healthy bacteria to maintain a calm, non-inflammatory environment. Research indicates that when a woman experiences dysbiosis in the vaginal or cervical area, it creates a local inflammatory state that alters the health of the entire pelvic ecosystem. This localized imbalance makes it much easier for stray endometrial cells to take root, grow, and cause severe symptoms. When we look at the specific mechanism of how these gut bacteria directly interfere with your hormones, it comes down to a highly specialized enzyme. Certain families of bad bacteria that overgrow in an unhealthy gut have the unique ability to produce an enzyme called beta-glucuronidase. To understand why this matters so much, we have to look at how your body naturally processes and gets rid of estrogen. Estrogen is a vital hormone, but once your body has used it, it needs to be safely cleared out so it does not build up to dangerous levels. Your liver does an incredible job of taking this used estrogen, processing it, and wrapping it up tightly in a secure biochemical package. The liver then deposits this package into your bile, which travels down into your intestines so you can safely eliminate it from your body when you move your bowels. But when your gut is full of bad bacteria that produce high amounts of this beta-glucuronidase enzyme, something troublesome happens. This enzyme acts like a pair of biological scissors. It swims up to that secure package, snips it open, and unwraps the estrogen. Once it is unwrapped, that used estrogen is no longer bound for elimination. Instead, it gets reabsorbed straight through your gut wall and goes right back into your bloodstream. Let us talk about what happens when that unwrapped estrogen goes back into your bloodstream. You now have a much higher amount of active estrogen circulating through your system than your body ever intended. Remember, this misplaced uterine tissue is completely dependent on estrogen to survive and grow. By reabsorbing your own waste estrogen through an unhealthy gut, you are essentially pouring fuel onto a fire. You are feeding those pelvic lesions with a continuous supply of extra hormones, encouraging them to expand, thicken, and cause even more pain. This is why we cannot treat this condition by simply looking at the pelvis. We have to look at the digestive tract because the bacteria in your gut are directly regulating your systemic hormone levels. To fix this, we use a very structured, deeply elegant framework in our practice called the 5R approach. This is a step-by-step process designed to rebuild the health of your digestive tract from the ground up, calm your overactive immune system, and restore balance to your hormones. It takes time, but it is incredibly effective, and it requires no extra money, gym memberships, or special hospital equipment. It is all about working gently with the natural laws of your biology. The very first step in this framework is to remove. This means we must clear away anything that is causing irritation, creating inflammation, or disrupting the delicate ecosystem of your gut. We start with the food you eat every single day. We guide patients through a strategic elimination plan, which is essentially a clean, deeply nourishing, anti-inflammatory diet. A wonderful approach is a simple 10-day detox style of eating where you completely remove highly processed foods, refined sugars, dairy, and gluten. This style of eating acts as a gentle reset button for your entire system. It immediately cools down the fires of inflammation and provides your liver with the clean environment it needs to do its job properly. But removing isn't just about food. If our testing shows that you have an overgrowth of bad bacteria or weeds in your digestive tract, we must remove those troublesome residents as well. We often use targeted, gentle botanical herbs or occasionally specific prescription medications to clear out the bad bugs from your inner garden so the healthy plants have room to expand. The second step is to replace. Sometimes, when a body has been under chronic stress or dealing with long-term inflammation, it loses its ability to produce enough of the essential elements required for proper digestion. We might need to replace missing stomach acid or natural digestive enzymes. This simple step ensures that the food you eat is actually broken down completely, preventing large, undigested food particles from irritating your intestinal wall. The third step is to reinoculate. Once the weeds are gone and the digestive process is supported, we want to replant the good, beneficial bugs in your inner garden. We do this by introducing high-quality probiotics, which are the live, friendly bacteria your gut needs. But simply throwing capsules at the problem isn't enough. We also have to provide these good bugs with the right food so they can settle down, multiply, and thrive. This is where prebiotics come into play. Prebiotics are specific types of plant fibers and vibrant plant compounds called phytonutrients. When you eat a diet rich in these colorful natural plant foods, you are directly feeding your internal allies, allowing them to rebuild a strong protective shield over your intestinal lining. The fourth step is to repair. A leaky, inflamed gut wall needs specific raw materials to heal itself. We use gentle, natural nutrients to soothe and patch the physical lining of your digestive tract. This helps microscopic gaps in your gut wall close up tightly, stopping the leakage of toxins into your bloodstream and allowing your immune system to finally step down from high alert. The final step is to rebalance. This is where we recognize the profound, unbreakable connection between your mind and your body. Your digestive tract is lined with millions of nerve cells, and it is highly sensitive to your emotional state. When you are constantly rushing, worrying, or stuck in a state of high anxiety, your body is operating under the sympathetic nervous system, often called the fight or flight mode. In this state, your body completely shuts down proper digestion and healing circulation. To truly repair your gut and balance your hormones, we must actively practice techniques that switch the body into the parasympathetic nervous system, which is the rest, digest, and heal mode. This can be as simple as pausing for deep, slow belly breaths before you eat, prioritizing quality sleep, or finding small moments of quiet throughout your busy day. This costs absolutely nothing and takes very little time, but it changes the entire chemical landscape of your body. When I first began practicing this type of medicine, one of the most eye-opening lessons I learned was the power of food as actual medicine. I remember learning about how something as simple as flax seeds could completely alter a patient's hormone patterns. Flax seeds contain unique fibers that directly improve how your gut bacteria handle estrogen, helping your body package it up and eliminate it safely. Another beautiful example is soy, specifically the natural compounds found in whole traditional soy foods, which are called isoflavones. For years, there's been a lot of confusion and unnecessary fear surrounding soy. People worry that because it contains plant-based estrogens, called phytoestrogens, it might cause hormone levels to skyrocket or make conditions like endometriosis worse. But the reality is actually the exact opposite, and the science behind it is truly elegant. Phytoestrogens are incredibly weak plant molecules. They look very similar to your body's own strong, potent estrogen, which means they can float over to your cells and sit down on your estrogen receptors. Think of your estrogen receptors like a row of chairs. When your body is dominant in its own strong estrogen, or when you are exposed to harsh environmental chemicals that mimic estrogen, those aggressive molecules lock onto those chairs and overstimulate your tissues, causing inflammation and growth. But when you consume gentle plant estrogens from foods like whole soy, those weak plant molecules sit down in the chairs first. They occupy the space, but they only give a very soft, gentle signal to the cell. By taking up those seats, they physically block your own strong, aggressive estrogen and toxic environmental chemicals from binding to the receptor. It is a natural balancing act that actually lowers the overall estrogenic stimulation in your body, protecting your tissues from overgrowth. This is the level of specificity and care that your body deserves. However, many people are living their lives on an empty tank without even realizing it. As we move through big transitions in life, whether it is a change in routine, a new job, a major move, or simply moving through the seasons, our bodies require an enormous amount of resilience, stable hormones, and deep rest to keep up. Yet so many individuals are sprinting forward while carrying hidden internal burdens. They might be dealing with low iron levels that leave them chronically exhausted, elevated levels of systemic inflammation that cause vague body aches, or subtle hormone imbalances that quietly drain their energy day after day. These changes happen quietly, in the invisible stage, long before they turn into an obvious illness or severe pain. This is why I always emphasize the absolute necessity of comprehensive, deep health testing. You cannot fix what you do not look for. Traditional blood tests often only scratch the surface, checking a few basic markers and telling you everything is fine when you still feel terrible. To truly understand your health, you need a deep dive. You need to look at a wide array of markers, checking over 100 different items that cover your heart health, your hormone levels, your vital nutrient stores, toxic exposures, and metabolic function. Having access to this kind of comprehensive data allows you to see exactly where your body stands right now before life shifts into high gear. It gives you the precise information you need to make small, simple habit corrections that will prepare your body to move forward with strength, balance, and true vitality. If you are someone out there listening who is dealing with severe menstrual issues, intense cramps, chronic abdominal pain, or a formal diagnosis of endometriosis, you are likely very familiar with the standard medical routine. When you take these complaints to a conventional clinic, the toolbox you are offered is usually very small. Typically, you are handed a prescription for a birth control pill, or you are given heavy pain medications to mask the discomfort. In more severe cases, doctors might suggest medications that essentially push your body into a state of premature menopause. To me, treating a young woman by forcing her body into early menopause is a deeply heartbreaking and counterproductive approach. It does not solve the underlying dysfunction. It simply shuts down the entire system because we do not know how to fix the communication lines. But there is a completely different way to look at this, a method that is incredibly specific and granular. For instance, remember that troublesome enzyme we talked about earlier, the beta-glucuronidase, that is produced by an overgrowth of bad bacteria in the gut. In conventional medicine, there is no real treatment for that besides ignoring it. But in a root cause approach, we can be incredibly precise. We can use a very specific beneficial probiotic strain called Saccharomyces boulardii. This is not just a random capsule you pick up off a grocery store shelf. It is a unique, friendly yeast organism that has been shown in clinical studies to directly lower the levels of that specific destructive enzyme in your digestive tract. By introducing this ally, we stop those bad bacteria from snipping open your estrogen packages. This simple, targeted step keeps your estrogen bound up and moving safely out of your body, immediately lowering the hormone burden feeding your pelvic tissues. This is the beauty of biology when you know how the gears turn. This brings us to a massive factor that is quietly shaping our health every single day, and that is the concept of environmental toxins. Specifically, we need to talk about a group of chemicals known as xenoestrogens. The word xeno simply means foreign. So xenoestrogens are foreign, man-made chemicals present in our modern environment that look and act like estrogen once they enter the human body. They are completely alien to our natural biology, yet they are incredibly pervasive. They have the terrifying ability to float through your bloodstream, lock onto your delicate estrogen receptors, and mimic the behavior of natural hormones. They can also completely disrupt how your liver breaks down your own natural estrogen, skewing your hormone ratios and creating a state of severe estrogen dominance and hormonal chaos. When we look around our modern world, we find these chemical mimics hidden in places we interact with constantly. One of the most famous examples is a chemical called bisphenol A, which most people know as BPA. This is a compound used to make hard plastics, the very plastics used for water bottles, food storage containers, and even the invisible linings inside metal food cans. But BPA is just the tip of the iceberg. Xenoestrogens are also heavily present in everyday personal care products in the form of parabens and phthalates. These are the chemical preservatives and plasticizers hidden inside your favorite shampoos, body washes, lotions, cosmetics, and perfumes. We also find them in our food supply and water systems due to the widespread use of industrial agricultural chemicals like pesticides and herbicides. Even highly toxic compounds like dioxins, which are byproducts of industrial manufacturing, find their way into our air, soil, and water, eventually building up in our tissues. It can be deeply frustrating to realize just how surrounded we are by these invisible compounds. What makes this even more complex is that research indicates much of our exposure to these toxic disruptors actually occurred before we were even born. When we were developing as a fetus inside our mother's belly, or during our very early years of childhood, our developing systems were incredibly sensitive to these environmental signals. Early exposure to xenoestrogens can actually program our genes and alter our tissue development, significantly increasing our risk of developing hormone-driven conditions like endometriosis later in life. When patients hear this, they often feel a sense of hopelessness. They ask me how they can possibly heal if the damage was done decades ago before they had any control over their environment. But I always tell them that while we cannot change the past, we have immense power over our present. Your body possesses a beautiful, incredibly sophisticated internal detoxification system that is constantly working to clean your inner terrain. Our job today is twofold. First, we must do everything we can to lower our current exposure to these chemicals, taking the unnecessary burden off our system. Second, we must actively provide our body with the specific nutritional tools it needs to support and supercharge its natural detoxification capacity. This is where the science of nutrition becomes incredibly exciting. You have likely heard that you should eat your vegetables, but from a biological standpoint, certain vegetables act as highly targeted medical treatments for your liver pathways. I am speaking specifically about cruciferous vegetables, a family that includes broccoli, cauliflower, cabbage, Brussels sprouts, and collard greens. These vegetables are packed with unique, sulfur-rich compounds called glucosinolates. When you chew and digest these plants, those compounds transform into a highly therapeutic substance called sulforaphane. Sulforaphane is an absolute powerhouse when it comes to cellular cleanup. It does not just provide basic nutrition. It actually travels deep into your cells and activates a genetic pathway that controls your body's master detoxification systems. It acts like a supervisor walking into a lazy factory, turning on all the lights and telling the workers to get moving. Specifically, sulforaphane supports both phase 1 and phase 2 detoxification pathways in your liver. It helps your liver take fat-soluble toxins, environmental chemicals, and used hormones and convert them into harmless, water-soluble packages that your body can easily eliminate through your urine and stool. It also triggers your body to produce more glutathione, which is your body's ultimate master antioxidant and detoxifying agent. This is why I regularly recommend concentrated forms of sulforaphane, essentially the essence of fresh broccoli sprouts, in a clean capsule as a foundational treatment in my clinical practice. It is a simple, cost-effective habit that profoundly shifts how your body processes dangerous hormones. To make this treatment truly personalized, we also look closely at a vital biochemical process called methylation. Methylation is a continuous, silent chemical reaction happening billions of times every second inside your body, and it plays a critical role in how your liver metabolizes estrogen and clears out toxins. If your methylation pathways are sluggish or compromised, your liver cannot process estrogen efficiently, leading to an accumulation of aggressive inflammatory hormone byproducts. In our clinic, we do not guess about this. We run advanced testing to measure specific markers of methylation health, such as homocysteine and methylmalonic acid. These detailed markers are far more accurate and revealing than the standard, basic blood tests you typically receive at a routine checkup. They tell us exactly how well your cells are performing this vital clearing process, and they show us precisely what your individual body needs to thrive. When we look at methylation testing, what we are really looking at is your body's need for vital B vitamins. Specifically, we look at vitamin B6, vitamin B12, and folate. But it is not just about taking any random vitamin pill you find on a drugstore shelf. Many cheap, generic supplements contain synthetic forms of these vitamins, like folic acid, which your body has to work incredibly hard to convert into a usable form. For many people, due to small variations in their genetics, their bodies simply cannot perform that conversion efficiently. If you take the wrong form, it can actually clog up your system and do more harm than good. That is why we look at methylated forms, such as methylfolate and active B12. These are pre-activated vitamins. They are already in the exact form your body needs, meaning they can go straight to work supporting your liver, clearing out bad estrogen, and calming your nervous system. We also look very closely at magnesium. In my many years of practice, I have found that magnesium deficiency is incredibly common. Yet it is one of the most powerful tools we have for calming an inflamed body. Magnesium is involved in over 300 different chemical reactions in your body. It helps relax the smooth muscles of your uterus, reducing the severity of painful cramps. It also plays a key role in supporting the liver as it breaks down hormones. Identifying these individual nutrient needs allows us to create a truly personalized care plan tailored precisely to your genetic makeup and cellular environment. Beyond targeted nutrients, we have to look at the simple, common sense habits that reduce the chemical burden on your system. We live in a world that is heavily saturated with synthetic compounds, but you can protect your inner terrain with a few highly effective changes. First, focus on filtering your drinking water. Municipal water systems often carry trace amounts of industrial chemicals and agricultural runoff that can interfere with your endocrine system. Second, make a strict rule never to cook, heat, or store your food in plastic containers. When plastic is heated, or even when it sits in contact with fatty foods, it leaches those harmful xenoestrogens straight into your meal. Switch to glass, stainless steel, or ceramic containers instead. Third, be very mindful of what you put onto your skin. Your skin is your largest organ, and it absorbs chemicals directly into your bloodstream without passing through the protective filter of your liver first. Look closely at your makeup, lotions, shampoos, and household cleaning products. Choose clean, plant-based products that are free from synthetic fragrances, parabens, and phthalates. There are wonderful, free resources available from public environmental health groups that can help you scan your products and find clean alternatives. Finally, avoid ultra-processed foods entirely. These factory-made items are loaded with artificial additives, preservatives, and unhealthy fats that trigger systemic inflammation and damage your gut microbiome. These are small daily choices that cost almost nothing, but they drastically cut down the amount of foreign estrogen entering your body. Now let us discuss the role of surgery. Sometimes, a specialized procedure called laparoscopic surgery is a necessary and highly valuable tool. If a woman is experiencing severe, unmanageable pain that makes it impossible to function, or if she is facing major fertility struggles, surgery can offer immediate and profound relief. During this procedure, a surgeon can go into the pelvic cavity and carefully remove or debulk the painful endometrial tissue, scar tissue, and adhesions. This can clear the physical blockages around the ovaries and fallopian tubes, restoring proper anatomy and lowering local irritation. However, it is absolutely vital to understand that surgery is not a permanent cure for the condition. Surgery is like going into a garden and pulling up the weeds by cutting off their tops. It clears the view and gives you temporary space, but it does absolutely nothing to change the quality of the soil. If the soil remains full of the wrong nutrients, if it is overly damp, and if the environment is perfect for weeds, those weeds will eventually grow right back. The exact same thing happens inside your pelvis. If you undergo surgery to remove the tissue, but you leave your body in a state of high inflammation, gut dysbiosis, and toxic estrogen dominance, those endometrial cells will return. Clinical experience shows that many women end up needing multiple, repetitive surgeries because the underlying terrain was never addressed. We must use surgery when necessary, but we must pair it with lifestyle and biological corrections to ensure the problem does not return. This is why foundational lifestyle interventions are so powerful. They create an internal landscape where disease simply cannot thrive. The absolute best place to start is by eating more whole foods that you cook at home. When you prepare your own food from scratch using fresh, single-ingredient building blocks, you naturally eliminate a massive amount of hidden chemicals. Research actually shows that when people switch from a diet of packaged, processed foods to fresh, home-cooked whole foods, the levels of toxic plasticizers and chemicals measured in their urine drop substantially in a very short period. Your diet should be built around vibrant, colorful, anti-inflammatory plant foods, healthy fats, and clean proteins. We also have to place a major emphasis on stress management. When you experience chronic physical pain, a very tricky biological process happens within your nervous system. Over time, the continuous pain signals cause the neurons in your pelvis and your brain to become highly sensitized. It is like winding a guitar string tighter and tighter until the slightest touch creates a massive loud sound. Your nervous system becomes wound up, making you feel pain much more intensely than before. Chronic emotional stress directly feeds this process, keeping your body flooded with stress hormones that amplify inflammation. To calm this hypersensitive wiring, we must actively use techniques that soothe the nervous system. Simple practices like regular breath work, gentle movement, and acupuncture can deeply change how your body perceives pain. Acupuncture, in particular, is wonderful because it helps stimulate local blood circulation, releases natural pain-relieving chemicals in the brain, and helps shift your body out of stress mode and into a state of deep structural healing. Let us look closely at another crucial element of your daily nutrition, and that is the type of fat you put into your body. We live in a society that has been flooded with highly processed industrial vegetable oils, which are packed with pro-inflammatory omega-6 fatty acids. These fats act like liquid friction inside your blood vessels and tissues, turning up the volume on pain and swelling. To counteract this, we must actively introduce powerful, natural anti-inflammatory fats, specifically omega-3 fatty acids. You can find these beneficial fats in high abundance within wild-caught, cold-water fish like salmon, mackerel, and sardines, or through pure, high-quality fish oil supplements. Think of these omega-3 fats as a soothing, cooling oil that bathes your cells, calming down the overactive immune response and naturally lowering the production of inflammatory chemicals in your pelvic region. Now, there is one major metabolic connection that almost completely gets ignored in conventional health clinics, and that is the profound relationship between your blood sugar, your insulin levels, and your hormones. Many people do not realize this, but your body fat is not just a passive storage cushion for extra calories. It is actually a highly active, living endocrine organ that manufactures its own hormones. Specifically, your fat tissue contains a high concentration of that enzyme we mentioned earlier, aromatase, which has the power to create estrogen. The more fat tissue a person carries, particularly around the belly, the more extra estrogen their body is actively manufacturing every single day. To see how powerful this mechanism is, we only have to look at what happens to men who become highly overweight or consume large amounts of refined carbohydrates and alcohol. Over time, as they develop significant belly fat and deep insulin resistance, that fat tissue begins converting their male hormones directly into estrogen. As a result, they begin to lose their facial and body hair, and they even begin to develop physical breast tissue. It is not because they have a hidden medical tumor. It is because their metabolic imbalance has turned their fat cells into an estrogen factory. The exact same biological process happens inside a woman's body. When your diet is high in refined starches, sugars, and ultra-processed foods, your blood sugar spikes dramatically. In response, your pancreas is forced to pump out mass amounts of a hormone called insulin to drive that sugar out of your blood and into your cells. Insulin is an incredibly aggressive, highly pro-inflammatory hormone when it is constantly elevated. It acts as a master storage signal, forcing your body to pack on weight specifically around your abdominal area. It also leaves you feeling completely exhausted, drained, and foggy-headed because your cells are starved for steady energy. But worst of all, for conditions like endometriosis, these high spikes of insulin directly stimulate your fat tissue to churn out even more active estrogen. You end up trapped in a dangerous metabolic loop. Your blood sugar spikes, your insulin climbs, your body stores more belly fat. That fat manufactures extra estrogen, and that extra estrogen flows straight to your pelvis to feed and expand those painful endometrial lesions. This is why we cannot treat this condition as a simple localized issue in the pelvis. We have to treat the whole metabolic terrain of the body. When we step back and look at everything we have discussed, the path to long-term healing and prevention becomes beautifully clear. It is all about systematically rebuilding a healthy, balanced terrain inside your body. We want to create an internal environment where inflammation is naturally kept low, where your liver is fully supported to metabolize and clear out estrogen efficiently, and where your microbiome is thriving. This means protecting the delicate balance of friendly bugs, not just in your digestive tract, but also within the reproductive tract. We must be incredibly careful to avoid the unnecessary use of antibiotics, which act like a sweeping wildfire through your inner ecosystem, wiping out the protective good bugs and allowing the toxic enzyme-producing weeds to take over. Instead, we want to feed our inner allies every single day with a rich variety of colorful plant fibers, clean whole foods, and deep restorative sleep. We must actively work to balance our blood sugar, reverse insulin resistance, lower our exposure to environmental chemicals, and gently soothe our overstimulated nervous systems through regular movement and stress reduction. These steps are simple, common sense practices, but when you apply them consistently, they possess an incredible life-changing power. I want to look you in the eye and remind you of something vital. If you are suffering through this, you are not broken. Your body is not failing you out of spite, and it is not acting randomly. Your symptoms and your pain are simply a direct response to a compromised internal environment and a sea of confusing signals. The intense pain you are experiencing is real, and it is a clear message that your system has lost its balance. While conventional medical treatments like surgery or birth control pills can provide a helpful, temporary pause, they are fundamentally incapable of altering the deep biological landscape that caused the problem in the first place. You deserve answers that go far beyond simply suppressing your hormones or masking your symptoms with heavy medications. I deeply encourage you to take control of your health journey. Work closely with a skilled, root cause practitioner who understands how to look at the body as a whole, interconnected system. Take the time to carefully track your unique monthly cycles. Insist on advanced testing to analyze the health of your gut microbiome. Evaluate your heavy metal and toxic chemical burdens, and deeply map out exactly how your liver is processing your hormones. When you stop guessing and start addressing the true root